Good afternoon, everyone, and welcome to the California Black Health Network's Health for Life series on caregiving in the Black community. I'm Rhonda Smith, the Executive Director of CBHN, and we thank you all for attending today. So our session today is the last and final session in a 5-part series on caregiving in the Black community entitled Navigating Resources. And thank you to those of you who have participated in the past sessions, and definitely to those of you who have attended all 5. And a big thank you to our sponsors, CAN Health Plan and AARP. We greatly appreciate your partnership and support of this series. We're very fortunate today to have 2 great speakers, Julia Yabo and Rita Chula. I'll tell you a little bit more about who they are in just a few minutes. But they will both share their personal caregiving stories and spotlight practical resources, solutions, and tools to support your caregiving journey, should that be a situation that you're dealing with or at some point in the future will be dealing with. So family caregivers exist across all demographics. All people of color care for their loved ones at some age, no matter what their gender is, socioeconomic status, or race or ethnicity. And currently about 40% of caregivers really identify as a person of color. And within each of those racial groups, we face higher rates of caregiving compared to our white counterparts. So while we as caregivers tend to receive more support from within our family and friends in our circle, white caregivers don't as much, and we face a bit more challenges than they actually experience. So we'll talk a little bit about what some of those are today. But before we begin the program, I'd like to cover a few housekeeping rules or items. We'll first hear from Julia and then Rita. The chat box will be open if you want to say hello to someone or to the speakers or make a comment. If you have any questions, please put them in the Q&A box so that we can keep track and make sure we answer all of your questions. Please note that everyone will remain muted and off camera during the session. And also, before I introduce our featured guests, I'd like to, for those of you who may not have attended one of our sessions in the past, just tell you a little bit more about the California Black Health Network and who we are and what we do. So our vision is to ensure that every Black Californian, that includes African Americans as well as Black immigrant, has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we do that every day through our mission to ensure that no matter who you love, who you are, how you self-identify, how well educated you are, what your housing status is, all of that, everyone has the opportunity to access quality, equitable, primary, as well as behavioral health care, and definitely avoid succumbing to diseases that are preventable. Okay, so now I'd like to move on to introduce our first speaker. That's Julia Yabo. Julia is a multiple Emmy-winning award broadcast journalist and has more than 25 years of experience anchoring and reporting and covering hard news as well as environmental education and human interest stories. Having been a family caregiver to an elderly parent, Julia is passionate about raising awareness and educating others to the realities of facing family caregivers and improving available resources and services. She launched Keeping It Real Caregiving, a website, blog, podcast, and public speaking platform to produce segments highlighting the challenges that we face when caring for our loved ones. Julia also produces a bi-weekly newsletter of the same name, offering content direct to readers and people seeking information about resources and support during their caregiving journey. Julia currently serves as a communication consultant with the national media firm Magid Associates. She is well known in the Northern California area and community for having served as a morning anchor for KHSL and KNVN Action News Now in Chico, California. She's held previous positions as an anchor with NBC6 TV in Miami, KCBS TV in Los Angeles, as well as stations in other places in South Florida, Louisville, Kentucky, and Pensacola, Florida. So I'll turn it over to Julia, and Julia, you can take it from here. Thank you for being here today.
Thank you very much, Rhonda. I appreciate it. And I'm clicking on to my video, and it's saying that I can't start my video. There it goes. All right. Thank you, everybody, for being here today and taking part. I'm honored to have been asked to share my personal caregiving story with all of you in hopes that some of what I went through and my whole reason for creating Keeping It Real Caregiving was to share information. And one of the things that I like to say, and if we start working together or you follow any of my work, you'll often hear me say, you don't know what you don't know. And when it comes to family caregiving, I learned firsthand by caring for my mother that the best thing we can do as we enter into the role of family caregiving is understand that we don't know what we don't know, which means we constantly have to educate ourselves, seek out resources, look for information. So I am going to share my screen. I have a short presentation that'll go along with what I'm talking about. And there we go. And you guys can see that, right? And hosts can let me know that you can definitely see that. And
Definitely can see that.
Okay, I'm going to hit play from current slide. There we go. So I call this presentation, and when I talk about family caregiving, practical planning and preparing, some of the down and dirty need to know things that come with family caregiving, which is why I called my platform Keeping It Real Caregiving. As Rhonda mentioned, 53 million US Americans identify as family caregivers. A lot of organizations that are out there providing resources, support, guidance. But when it comes to the daily hands-on activity of caring for a loved one, perhaps in your home or finding services, it can be a much different journey, which is what I experienced. So I'll just tell you a little bit about my journey with my mother, Nellie Pearl Yarbo, our caregiving journey, some things that I want everybody to think about when it comes to family caregiving, some ways that all of us can connect the dots so that we can help ourselves, our family members, and others in the community. And then, of course, we'll wrap up with any other questions and Q&A at the end. And again, as I said, you don't know what you don't know. So the first rule of thumb that I say to everybody is, even if you are not yet in the role of family caregiving, to begin educating and preparing yourself for this world. If you wait until you're in a crisis position, you no longer have the ability to pick and choose services, to do your research, to do your homework. You're now responding to something as opposed to being prepared ahead of time. So how do we do that? One of the things that I started learning early on was that I had to change my mindset and realize that while my mother was my mother, I quickly learned that I had to become the parent. And the sooner that you can accept within yourself that you are a family caregiver, the better. I can tell you from my own personal experience, when I first started caring for mom, it was almost 20 years ago. And I didn't really understand that I was a family caregiver, and I wanted no part of it. I did not want to identify as a caregiver. I thought my mom is perfectly fine and capable of taking care of herself. And I didn't do as much homework as I probably should have. And as you can see, this is a photo from when I was a child, and it all along my life journey, it never dawned on me that I would be one day taking care of my mother, who always seemed capable, self-sufficient, very driven. And some of that vision is what held me back from accepting the fact that I was a caregiver. So I would encourage all of you to really think about, if you're already in it, you've experienced some of this. If you think, well, mom and or dad or another loved one is getting older, that's never going to be me. I encourage you to start thinking about it now. And again, as a child, never would have entered my mind that I would be caring for my mom. As we got older, I aged, and my mother. Mom was with me at every event I went to, all kinds of travels. I still wasn't quite figuring that I would be caring for her. And even in this photo here, we went to New York one weekend for her birthday. And I recall that as it was getting, the sun was going down and mom was getting really agitated. She was afraid to be outside walking. Early on at that point, because I had not educated myself, I didn't realize that she was having difficulty seeing. She was having difficulty walking. She felt fearful being around a lot of people. So even at that stage, some of those signs were indicative of some of the medical issues that she would then have later in life. So it's important that we stay aware of our loved ones, notice any changes in their behavior, notice changes in their agitation level. All of those can be signs of, yes, just sheer aging, but also a sign of perhaps some other medical condition. So it's important that we just stay alert to what's happening around us. I can tell you that at this stage, I never thought that I would be at a moment in life where I would be in charge of preparing all of my mother's food, of showering and bathing her and understanding how to do that safely, of needing to understand how to purchase personal products, including adult diapers, and to literally at 2 a.m. get up in the middle of the night and change an adult diaper. But that became my reality, and it was a daily or nightly situation for me as a family caregiver. One of the aspects that once I was in that, I realized if I had somebody who could have guided me through some of the lessons that I needed to know, that would have helped me tremendously in being prepared of what services, products, personal support that I could have received from others. So I want to share with you a nugget that a friend said to me early on. He said, Julia, if you start to adhere to the concept that you get to take care of your mom, not I have to take care of mom, your entire mindset will be different, and you will embrace your journey as a caregiver in a much more open situation rather than fighting against it. Embrace it early. And I cannot tell you how valuable that is to accept the journey that you may be on already or that you will enter into, so that you can see it from a very clear and appreciative perspective. As mom aged, I then had to move from just spending time with mom to literally finding housing for mom. She lived here with me in Northern California for the last 5 years of her life. My mother had diabetes. She had Parkinson's disease, high blood pressure, heart disease. As she aged, she began losing her mobility. In the final year of her life, I was no longer able to care for her here at my home, and I had to research assisted living facilities that would be suitable for my mother. And this is an area where I will say that I love California. I love that I am from our state. I believe that we're very progressive, but I live in rural Northern California. And as a woman of color, caring for an older woman of color, it became clear to me instantly that some of the care choices and steps that I needed to take were very specific, focused on the fact that we are women of color, and there weren't very many people around our circle that looked like us. So as I began researching different doctors, services, in-home care, facility care, I had to then ask questions that maybe some of my Anglo counterparts did not have to ask, such as, do you have anyone on staff who looks like us? And if so, what are the hours they work and what are their shifts? Has your staff been trained or had any contact or outreach with those who look like us? What might be procedures that are in place that if my mom encountered an uncomfortable situation or perhaps some sort of interaction with a fellow client that made her feel less than, unsafe, or straight, direct racist behavior, how is that going to be addressed? And I can share with you, when I asked several of the administrators at the local facilities those questions, they were slightly taken aback that I would ask. And I didn't ask in a way of saying that I expect this to happen. I asked those questions because I wanted to cover every base that might happen. After all, my mom was in her, her late 80s, almost 90 at this point. And by sheer numbers, I'm thinking many of the contemporaries that were in the facility with her may have been at an age and a time that they may have never had any interaction with a person of color. So those were some of the questions that I had to begin asking. And it was the same for doctors. I had to find out, had these doctors ever treated a patient of color? Were they approaching her medical care and needs from a viewpoint of the medication she needed, or her care may have been slightly different than an Anglo counterpart? So those are some things to think about as you move through your caregiving journey. My mother passed in September of 2020. The dates and numbers sort of run together. It was not from COVID. It was during the middle of COVID. And in the last year of Mom's life, as I said, she was in a facility, an assisted living facility. And I was able to be with her up until her final breath. Luckily, I was there with her. And once I moved through this journey, I knew that I wanted to start sharing stories, information, lessons learned with others. And so I created Keeping It Real Caregiving because, again, I realized that there were so many hands-on issues. For instance, we had a hospital stay at one point after Mom had a heart attack, and the doctors and the nurses insisted on changing her medication when she was in the hospital. Because I was there physically to be an advocate, and I encourage all of you, if you are in this role, you must become your loved one's advocate. Be their voice. Be the person who is there with them as much as you possibly can. I quickly realized that because the doctors and nurses were changing her medication or changing the times that she was taking medication, it was causing her to have an emotional downward spiral because some of her medication was neurological for her Parkinson's disease. I had to educate myself about the medications, about the times that she should have those medications, because when the doctors changed those, it created a downward spiral in her overall health. And I could then see that those doctors and nurses were treating her differently, almost as if to say, well, she's older, she's weak, she's declining. Maybe we won't pay as much attention to her. And I said, no, this is not my mother's benchmark. Something has happened within 48 hours. This is not the woman who has been with me at home. So I was there to make sure that she had the right medications at the right times, to ensure that nurses didn't just bring her food and leave it, and then maybe she wouldn't eat. I would stay there to make sure she had her food. I would ask the doctors questions, not in a disrespectful manner, but in a way that said, I would like to have full information of my mother's care, what the care plan is, what I need to do once we're released. I cannot encourage you enough or stress enough that how important it is to ask questions. No question is out of line when it's you or your loved one that you're caring for. And so I started Keeping It Real Caregiving as a way to share some of that information. As we said in the intro, you can find articles, videos, podcasts. And the purpose behind that is that each of us as family caregivers experience something slightly different. It may depend on what region of the state we live, what resources we have at our disposal, how many family members or friends we have in our circle to help us. In my case, it was just me caring for my mom. And so some of the videos that I share are from other perspectives, other caregivers. Each of us has something that we can share with another that we have lived, maybe a do-it-yourself at-home hack that can help somebody else, emotional support that somebody may simply need to have another person listen to their angst, to learn how to talk to your employers about your situation, how to find services locally. I want to talk a little bit now about some of the practical aspects of why I say that it's so important, and what I truly believe in my heart that we have to be practical, plan, and prepare. I'm going to skip through some of this. I've done some other advocacy work with the American Society on Aging as I've gotten more involved with caregiving. I also am involved with the California Coalition on Family Caregiving, and we can share more information on this as well. But back to the nuts and bolts of all of you out there who are family caregivers. You've seen the numbers. If you're living this journey, you're already in it. If you're thinking, may not be me, the numbers and statistics don't lie. If 43.5 million family caregivers are here in the US, chances are it's you or someone you know, or it will be you soon. Now, these are numbers from 2020 from AARP. So we're 3 years past that point. Do the math. So here's what I want you to think about. Practical. I encourage all of you to not put this off and think, well, it won't be me and it'll be down the line. Start thinking about it now and be practical about it. I think of it as a roadmap, right? We would never get in the car and just drive without a map or our GPS if we had a destination. We would have a plan. So I encourage all of you to be practical. If there is anybody in your family, in your loved one, in your care circle that you believe or even suspect that you may be the person who is helping to care for them, start thinking about that in practical terms. What does that look like? Where will they live? Will they live by themselves? Will they live with you? Will they live with another relative or in some sort of facility? If that's the case, if they're staying in their own home, what aspects of that home have to be modified? Do you need grab bars in your shower, which we put in, thank goodness? Do you have to change the configurations of beds and hallways? Will a walker or a wheelchair fit in your home? Do you have stairs in your house? If you do, what does that look like? If you choose that you want your loved one to stay with you indefinitely, no matter what, think about what that means for the practical daily applications within your home. Think about travel, getting in and out of a car, going to and from stores, your shopping. Who's going to do that? Who's going to help you? How will you make that happen? Review medical insurance and any type of coverage that you and or your loved one have. Quite often, people will say, well, mom or dad or aunt or uncle, I don't know what they have in place at all. I encourage all of you to have those conversations early about what type of medical insurance does your loved one have? Is it Medicare, Medicaid, private insurance? What does it cover? For how much? Does your family member have a long-term care insurance coverage? And if so, what does the fine print actually say? So crucial to understand the finances and the paperwork and the medical aspects as you step into your caregiving journey. I will tell you on a personal level, I was fortunate enough that I had purchased long-term care insurance years ago for my mother under the urging of an HR director. I didn't know what I was purchasing. I just knew that it was some sort of coverage. And thank goodness I had that, because it allowed me to have in-home care for my mom so that I could keep working. But when it came time for us to find a facility for my mother to move to, because I simply could not safely care for her here at home, I learned that the fine print on my policy didn't dictate a location based on what care my mother needed. It dictated coverage based on whether that facility was a skilled nursing facility, an SNF, or an assisted living facility, ALF. I didn't know the difference until I discovered that while my mom needed a higher level of care, the facility we chose didn't fall under the category for having a higher rate of coverage through the insurance. So it became very expensive, although I had coverage, right? So it's important that you educate yourself. Do it early. Start reading this information. There's plenty of information online. AARP is a wonderful resource. Don't wait until you think, oh, I'll wait till I'm 55 to sign up for that. Sign up for AARP early. I learned so much by having that as a resource. Plan, prepare, be practical. We talked a little bit about SNFs and ALF. I'm a big believer in understanding the verbiage associated with caregiving and the aging space. A lot of services are acronyms. And if you don't understand what those are and understand how to ask questions of your doctors of your hospital, of your insurance company, you may say something that checks a box that then means you don't get the coverage or the assistance that you want or need. For instance, DME, durable medical equipment. If you're in the hospital and you know just those 3 letters, you know to then ask your care team, what might I be eligible for? Does my loved one need a walker? Is that covered? Does my loved one need a wheelchair? Maybe an electric bed, grab bars, other diabetic materials? What all is covered? Always ask those questions. Do not assume that somebody in the hospital is just going to tell you. Ask all of those questions. Finally, talk with others. Talk with the people in your care circle, your neighbors, your friends, your coworkers. When we stay quiet because we think that we're just in this alone, I believe we're hurting ourselves. Don't think that you're Superwoman or Superman and do it all on your own. Reach out for help. Ask and let people know that you are in this role. I can tell you that every single day since my mom passed, I miss her. I think about her. She's buried at the Presidio in San Francisco with my father. And I know that she would be thrilled that our journey is now helping others in terms of sharing this information, talking about it, pointing people in the right direction, and just being an ear. So I have my information here, and that's all available at the tail end as well. And I know this is a quick, brief overview, but so much that all of us can learn from each other. And we don't know what we don't know. So share what you've learned, ask others so that we can help each other. And then we can navigate through this. So I'm going to stop sharing and come back out here. And I believe I am at time.
Yes. Thank you so much, Julia. So again, if you have questions for Julia and or Rita coming up, please put your questions in the Q&A box. And Julia, I had the pleasure of meeting Miss Nellie many, many years ago when we were both living in South Florida. And yes, and you and I both share that experience of caring for our moms and being there with them, until the final moment. So I appreciate you sharing your story and your journey, and also offering some tips that keep it real for everybody who has to deal with this situation. So thank you so much.
Thank you.
Yeah. So next up is Rita Chula. She is the Director of Caregiving at AARP's Public Policy Institute. In her role there, she drives the development of family caregiving initiatives by providing content expertise with both AARP and in partnership with a range of external key stakeholders. Her work bridges policy and research to practice, centered on identifying and supporting needs of diverse family caregivers across ethnicities, cultures, and generations. Rita is moved to action by her personal experience as a family caregiver for her grandmother and then her mother, who lived with frontotemporal dementia while caring for her 2 small children. She is driven to ensure that systems are structured in a way to meet the holistic needs of family caregivers by working to advance equitable, culturally responsive policies and practices that elevate their unique experiences and enable them to manage their own well-being while providing care to others. So Rita, thank you so much for being here today and for sharing your story with us as well. So we'll have you, yes, perfect. Thank you so much.
Great. Thank you, Rhonda, and to everyone at the California Black Health Network. I think that this is such a wonderful webinar series. So often we don't talk enough about what it means to be a caregiver in Black communities, and it's such a critical conversation to have. I want to also recognize my colleagues at AARP California for their support of this webinar series. I will say, and I really appreciate Julia sharing her story and all of the tips and resources that were really drawn from her experience. And I have much the same experience. I think my experience differs in the sense of I am a sandwich generation caregiver. So many of you may know the term, but for those of you that don't, caregiving for me meant caring for my mother, so the older adult, as well as children. I had two small children that were born into this caregiving experience. And for 8 years of their lives, experienced that along with myself, my husband, and my sister. My caregiving journey started with my grandmother, actually, Thelma Booker, and it really was more about caring for her as she aged, but not in as a critical way as that of the care I needed to provide for my mother. After my grandmother passed away, we quickly began to notice some things that were happening with my mother. She kept falling. My mom, who typically was a very joyous, joyful person, suddenly became very apathetic and withdrawn. And we knew that there was something going on because this was not her personality. We then took her to her doctor, and that really started a very challenging journey to a diagnosis. She was diagnosed with several different types of mental health issues and illnesses that had never been present before. She was then ultimately next diagnosed with Alzheimer's. As someone that works in the field, I knew that the experiences and that the symptoms that my mother was having really were not related to Alzheimer's. And so I had to continue to pressure different doctors, go to different neurologists, and really come with facts. I had to arm myself with facts and the acknowledgement that I was the expert in this situation. Yes, I would have rathered the doctors and other clinicians to be the experts, but in order to advocate for my mom, I had to become that expert. So ultimately, my mother was diagnosed with frontotemporal degeneration. It is a type of dementia. I think quite often, not just in Black communities, but on a wider basis, we think of dementia as just Alzheimer's. Alzheimer's is a type of dementia, but frontotemporal degeneration, along with others, are as well. And they're very different symptoms. Ultimately, my mom lived with frontotemporal degeneration for 15 years. And as I said, my children were born into that situation, into that experience. And I will say it was one of the most challenging experiences of my life because I think we all want to have some semblance of control over our lives. We all want to ensure that the individuals in our lives, our parents, our friends, and other family are cared for. But because of this misdiagnosis and because of so many of the missteps and the navigating of a very broken healthcare system, as well as a social service system, I felt quite often that I had no control of this situation. And I felt that my mom, in many cases, wasn't receiving the best care that she could because people didn't know how, or the system wasn't supported or set up. And so we had to really create our own system. We had to fix the broken links of the system in a way that met our needs and that my mom was then supported. Like Julia, there came a time when we were not able to keep my mom in community. Part of that was because of the different symptoms that she did have related to the particular variant. She had the behavioral variant of this type of dementia. And that meant that my mom would, she had episodes of biting. She had episodes of hallucination and other things that really made it challenging to keep her in community as I was trying to raise really newborns and toddlers at the same time. Unfortunately, community resources were not as prevalent as they could have been. It was very difficult in our community to find resources to support not just this type of dementia, but affordable resources. And so ultimately, we did place my mom into a facility that very much understood what it meant to care for individuals with this type of dementia and other dementias, and care for them in a way where they could truly be themselves. Oftentimes with dementia diagnoses, we see that that individual that's living with dementia, they suddenly are put into a back room, so to speak. They are not included in day-to-day life experiences. They're not allowed to be who they are along this journey of dementia. And quite often it's because people don't know how to provide that care. The resources in our community are not necessarily always there, particularly within healthcare systems. And so it really is important to, I think, number one, and I was so happy to hear Julia say this, to recognize yourself in whatever situation you are in, whether it is cleaning up around the house after or for an older adult that can no longer do these things, or providing some type of personal care, such as bathing or helping them with toileting. It could be communicating with healthcare professionals or helping with medications. All of those things really make you a caregiver. You're providing that care. And we hear so often, I'm just the daughter, I'm just the son, I'm just the grandchild. But you are more than that. You are that and then some. And as you recognize your role as a caregiver, it potentially will help you say, you know what, this red cape that I'm wearing, this superhero cape that I'm wearing, and I'm saying this because I wore it with pride, that it's okay to put that cape down sometimes and ask for help and recognize that you need that help. And I think the difficult part about it is knowing what resources are there. We were doing some focus groups with Black family caregivers, and I'll never forget the family caregiver that said to me, you know, I can ask for help. I can admit that I'm stressed, but what is the point if there's nothing there for me? And so I recognize that there are so many challenges, particularly in Black communities and other communities of color, where it seems that those resources aren't there. And so really leaning in to learn more about that, and for providers to be able to more readily provide those insights and resources is extremely important. We know from AARP research that was conducted during COVID that caregivers in communities of color really bore the brunt of results from the pandemic. And yes, death rates were higher in our community, but I mean, even from caregivers who were providing care for older adult relatives and friends prior to COVID, that suddenly they did not have those external community supports. Suddenly they did not have the workforce that could come into the home and provide that care. And so now these caregivers, and I was one of them, I found myself working 24 hours a day. I was online doing my day job while at the same time I had two children that were on Zoom trying to do their schoolwork. And I was navigating and managing care for a mother that I could not physically hold anymore because she was in a nursing home and because of the restrictions. And what we heard from family caregivers like myself, like Julia, during this time period was that their stress was increased, that they lost control. They felt that they didn't have control of the situation. And they actually admitted, which in other surveys does not often happen, that the provision of care, that providing care to someone really was having an impact on their own health. And whether that was because they could not get the time to go to provide their own provider to get their own care, or whether it was the sheer stress of it, that they did indeed feel that impact. So again, when we talk about just being the daughter or just being the son, it's important to understand that you can do that and be that caregiver and ask for help and find resources. I want to talk a little bit about resources. I think Julia did such a wonderful job really giving the nuts and bolts on so many pieces. But I wanted to say that there are resources in community. AARP has a number of family caregiving guides that provide support to caregivers, whether you are doing pre-planning around what would happen if, or if you're in the heart of a crisis, because sometimes no matter how much we prepare, a crisis hits and we need support. And so these guides provide that. One guide in particular is our AARP financial caregiving guide. This is a really critical document. I really appreciated the development of it because all too often we don't talk about the financial piece of caregiving and how important that is, not just to be able to provide care for somebody, but to make sure you're able to care for yourself even after that caregiving journey is over. And so this family caregiving guide provides those opportunities and insights as well. In your own communities, there are entities called Area Agencies on Aging, and they are also called AAAs. Many communities have those, and those are excellent resources for what's happening in your local community. Within California, the Family Caregiver Alliance, along with other caregiving resource centers throughout the state, are really critical opportunities for caregivers to receive support for themselves. Sometimes we reach out for help helping others, but these caregiver resources also provide opportunities to help yourself. I was very happy to glance into the chat and see that a program that Dr. Fayron Epps leads, Caregiving While Black, as well as Altered Dementia, are both programs for caregivers targeted to Black caregivers. Julia talked about the need for supports within Black communities that mirror what we need in community. And that's so important to be able to look for that. Now, I will say that oftentimes, depending on where you live, it's not targeted to individuals in Black communities, but the resources do continue to be there nonetheless. Another thing I want to point out is support groups. There is such an important element to support groups, to being able to talk to other people who are living in their own way the same thing that you are, to be able to feel that you're not alone. Julia talked about 53 million family caregivers. You are certainly not alone. And the more that we talk about our experiences, the more that we normalize this experience outside of this is what I'm supposed to do, but really able to get to this is what I'm supposed to do. But you know what? Today it's very hard to do this. I need help. I feel alone. I'm tired. And to be able to lean on others in that same way, to be able to share those experiences are important. So finding support groups, either faith-based communities that are leading support groups or other resources in your community as well. AARP has an online Facebook support group that is very active. And so do many of the specific dementia and other disease organizations. They have resources as well. I think in closing, and to allow others to ask questions, I just want to reiterate this notion of putting the cape down. I know that within Black communities, there is the strong Black woman, the strong Black man. And this is a very critical piece to Black communities. This is really important, and we know where this comes from. But I do want to say that especially when you're providing care for others, it really is okay to not be that super person and to say, I need a little bit of help with this, and to lean in on other organizations that can really provide that help. So thank you for your time today.
Thank you, Rita. Thank you again, Julia. And I see there's a lot of activity in the chat, but Amber, could you check and see if there are any questions? And if we could bring Julia on to as part of the discussion. Yes.
Yes, the only question that I saw is just wanting to know if we are able to share out the resources. And yes, we will definitely share the resources and follow up to the webinar.
Okay, great. So if there are no other questions, I actually have a few questions. And I think in both of your stories, the thing that resonated with me, or the question, is about self-care, and really curious about what both of you did to ensure your self-care while you were caring for your moms or your relatives.
I can jump in. I'm going to admit this. I was horrible at self-care. I was very bad at self-care. And it's funny because while caring for my mother, I was also, on the road talking about caregiving professionally, and I would always say self-care, but I was really bad at it. I think the one way in which I was able to do it was to find joy in the moments. So to find time when I was I was nursing my daughter, while my son was sitting next to me, and really leaning into those moments that brought me joy and brought me satisfaction. The times when I was able to sit with my mom and just hold her hand and read her a book. And for me, nature. So nature walks, getting out even for 5 minutes to do a sun salutation, to feel the sun on your face, whatever it is that can bring you joy, recognizing that you don't have to go away for a 3-day, trip to a spa. I mean, that's great, but that you can find it in little moments too.
Great. And Julia, what about you?
Yeah, I think we share so many experiences and, those similarities. Yeah, and I didn't do a good job at the beginning, or maybe not even near the end. I'm a type A person, and as much as I can talk to people now and say, you've got to give yourself a break, you have to ask for help, somewhere in my mind, I had it that, okay, I know what's going to be best. I can handle everything. And I can honestly say it wasn't until I was doing an initial intake meeting with a representative from my local area agency on aging, to fill in the gaps with some care for additional resources. And as she's asking me all these questions of what all I do from day to day with my mom and between work and when I get rest and what all I'm handling. And as I'm talking to her, I just feel myself melting down, because I thought, oh my gosh, how am I surviving and managing all of this? And she just looked at me and said, you need help. And so sometimes on one side of our brain, we know we need help, but we're still not admitting that we should ask or take the type of help, because we think there's nobody else who could do the job as well as we can. So 2 things there is, you have to learn to let go and trust a little bit. You have to learn to do that. I would sometimes take an extra long shower. Once mom was down for a nap, I would that little mini spa trip would be a really, really long shower. It doesn't take you 15 minutes to get clean, but maybe I was just in there. And sometimes I would literally go sit in the car out front and just scream like I was on a roller coaster, just to get the stress out. And so it's so crucial. And just one final point, I can name 3 close friends who are caregivers, 2 professional caregivers, 1 a family caregiver, who have all become extremely ill shortly after finishing up. 1 is still in their duties, the other 2 have finished. That physical stress, emotional stress that we carry, if we don't take care of ourselves, we will then experience higher levels of medical issues ourselves. And you cannot take care of someone else if you have fallen to pieces. So we have to step back and accept help.
Yeah, it's like what they tell you to do when you're on a plane is put the oxygen mask on first, right, before you help others. Right. So we do have some questions in the Q&A box, and someone wants to know, what are other LA-based organizations you would recommend for people who are becoming caregivers? I don't know. Rita, do you want to take that one, maybe?
Yes, there is and I need to look up the link, and I can, if I don't find it quickly, I will follow up with it. But I was talking about the California Resource Centers. There is one out of LA. It's led by Dr. Donna Benton, who I know was on one of your guest speakers as well. And that is a caregiver resource center directly in LA, run out of USC. And I'll look for the link very quickly, but that is one that can be used.
Okay, great. And then this person says, I've noticed that the staff at the SNF and my family member's personal doctor are not in conversation. Is this an example of my need to fix a broken system or link, or like intervene as an advocate? Julia, do you want to take that one? Well, both of you feel free to comment, but
yeah, and again, I'll preface this by saying this is not, I'm not a doctor. I don't have any of those initials after my name, but from personal experience, I had that same thing happen where my mother's primary care doctor, once we were at a rehab for a short amount of time after mom's heart attack, all of a sudden there's this different doctor's name on her medication and writing prescriptions. And I said, well, who is this person? He or she has never even been here to see my mother. And they explained that, well, that's our facility doctor. I said, okay, but this person is not here on site. They've never seen mom. I don't know who they are. I've never talked to them. And when I requested to meet with them, I was told, well, they're only here, 1 day a week and they don't meet with anybody. So I pretty much had to just be, again, the advocate. And I demanded that all of mom's prescriptions stayed with her primary care. And I fought that. I don't really know what the laws and regulations are for that, but I made it very clear that I was not okay with a total stranger just writing prescriptions for my mother. But it's because I was there as much as I possibly could be, and I knew to ask those questions. So Rita, maybe you have some guidance on that.
Yeah, no, I was going to say something similar. I mean, that is definitely an idea of an example of a broken system. And in the report, actually, that Julia highlighted, the AARP report, I believe it's almost 25% of caregivers talk about the angst that they feel when trying to coordinate care across multiple doctors and in community. And so that is a huge thing. It's really important that you assert yourself as an expert and advocate from the very beginning. And it's difficult, it's troublesome, but it is something that until the system really is broke and there are solutions, that is something you have to do to be able to stay on top of things.
Great. And then someone wants to know what they should do, or how do they decide when a family member may not be able to live at home anymore? Like, what advice or words of wisdom can you share with them?
Yeah, that actually was one of the hardest decisions I've ever had to make in my life, to admit that we could no longer care for my mom at home. And it was a conversation where I really begged her forgiveness that I was not able to do this anymore. It was hands down the most emotional conversation I've ever had to have. But I think it's an important thing that we need to think about in community, in Black communities, because too often we don't admit that we're not able to do it anymore. And what happens is that individual doesn't receive the care that they need at home. And they actually go downhill even more or even quicker. And so really understanding what your capacity is as that family member and what resources that you have available to you, whether it's other individuals, whether it's financial, whatever it is, that allow you to keep that person with you, either in their home or in your home, or if their condition or your ability to care for them is just not something that can really keep them at home, to think about what it is, what it would mean to place that person. And it, again, is a very difficult decision to have, especially in these times. And that's why it is important to know your resources, because oftentimes there are resources available to help you keep somebody at home, but you don't know about that. So please reach out to these area agencies on aging and others to have that conversation and do your due diligence before making that decision.
And Julia, anything you'd like to add to that?
Full agreement, very difficult decisions. Have the conversations early. I had a friend who said, I promised my mom I would never. I said, don't make those promises because you do not know what's around the next corner. Our approach, again, very practical. I took the path of saying, I'm going to make a plan based on working backwards from worst case scenario. And so the conversation was, well, what happens when you're able to, I can still safely shower you and get you back to your room and you can get to the bathroom on your own. Okay, but what does it look like when maybe you lose mobility? And we know this is part of the Parkinson's degenerative process. So we know that's going to come. What do we want that to look like? And so for us, that was the benchmark, that when that mobility is gone, where you can no longer get to the bathroom on your own, that's when it's no longer safe for me. It's no longer safe for you. And in our case, I was surprised at how well my mom accepted that change. And her viewpoint was, I'm watching you struggle to lift me out of bed, lift me onto my potty chair, get me cleaned and dried and all of that. You're going to hurt yourself. And so she was okay with the move. And she had declined dramatically living with me. And I literally thought maybe I had a few months with my mom. Once we moved into the facility, in a weird way, it gave her a second life because she was then having interaction with other people. And she realized that, yes, she was old and declining, but there were others who were worse off than her. And it literally gave her a second wind. And she got to the point where she considered the people around her her friends and people that she cared about. So I think I got an extra 9 months of time with my mom because she was in the facility as opposed to her being at home. Every family's different. Have those conversations.
Great. I think we could talk for a lot more. I have a list of my own questions that I wanted to ask, but I'm glad that the audience had a chance to pose a few questions to the two of you. So before we wrap up, I wanted to give you an opportunity to say any final thoughts or words of wisdom that you want to leave with the audience today. Rita, why don't we start with you?
I would just say that it's okay to ask for help, that this is as much joy as caregiving can bring, that it is challenging, and that's just a reality of the role. And naming yourself as that caregiver and leading with that, I think is really critical to helping you take care of yourself and your own well-being, as well as caring for that person.
Great. And Julia?
Understand that it is challenging, but as Rita said, it is also rewarding. Do the best you can, and understand that once it's over, right? So you may be exhausted in the moment and think, I don't know how much longer I can go, but I promise you, once it's over, you will feel a loss because there's no going back, right? Once it's over, and you don't get to have your person back. So as challenging as it is, stay in the moment, do the right thing, and understand that you'll have all the time in the world afterwards to sleep or nap or, go away for the weekend, but you don't get to have your loved one back. They're gone.
Or go to the spa. Yeah, right.
Yeah. So stay in the moment. You get to do this. You don't have to do this.
Yes. So thank you both so much for being here today and taking time out of your busy schedules and sharing your personal stories about your caregiving journey with your moms. And I really do appreciate you being here and doing that today. So thank you so much. And I'll ask Ambria, can you bring up the slide so we can wrap up and send everybody on their way for the rest of the day? So just a couple of final things to cover. We have our Southern California 40th anniversary event coming up on December 7th in Los Angeles. If you haven't registered, please do so. You can go to our website on the events page and find information there about how to do that. Yes, I'm not done yet. Hold on one second. It looks like
Sorry about that.
The gremlins are all over the place today, right? Yeah, so anyway, you can go to our website and register there to attend the event. And even if you don't live in Los Angeles, if you're in the Southern California area, please do feel free to come and celebrate with us. It should be a fun-filled evening, and hopefully we'll be announcing some special guests that will also be in attendance sometime soon. The other thing I want to just share is if you want to stay connected to us, it looks like okay. So yes, so we would love for you to, if you go back to the previous screen, sorry. Yes, we would love to hear your feedback. Again, this is the last session in the series, and we would love to get your feedback on how this information was really helpful to you, and how we can do better at other webinars similar to this that we host going forward. So please take a moment if you can to scan the QR code. I believe we also will put the link to the survey in the chat, and send a follow-up email with the resources. So multiple opportunities to provide us feedback, but please it takes less than 5 minutes to actually complete the survey. So we look forward to receiving your feedback. Now, next slide, please. Yes, and you can keep up with what we're doing and stay connected to us on our social media handles. So we're on everything pretty much except TikTok right now. If you want to view some of the previous videos in the series, you can go to our YouTube channel and search for California Black Health Network. You can join us in the campaign for Black Health Equity, and we'll learn more about that if you come to our LA event on December 7th. So I want to thank you all for attending today, and happy Veterans Day, and have a great weekend. Thank you. Bye-bye.